Hello, and thank you for joining us today during this Physician Chat Live series. My name is Dr. Ziad Khatib. I'm a Pediatric Hematologist-Oncologist at Nicklaus Children's Hospital. So today we're going to be discussing cancer, both adult and pediatric cancers. Can we prevent, and how can we prevent those cancers? In children, cancer is usually not a genetic and not related to the environment. It's what we call sporadic, by chance. For some reason, there is a mutation in one of our cells that leads those cells to multiply without any control. So we estimate that 85% of cancer in children is due to chance alone, and only 15% is genetic. The environment is not usually related to childhood cancers. Children don't drink alcohol, they don't smoke. So the cancers we see in children are due to these spontaneous mutations. As you see in this slide, for example, the normal cells are nice and dividing, undergoing mitosis on a regular basis. But for some reason, one cell has a mutation, and that cell starts to multiply uncontrollably. So what are the causes that lead to this uncontrolled cancer growth? Usually, in adults, it's a carcinogen. A carcinogen is a toxic substance that can lead to cancer. But even though cancers in children are not due to carcinogens, but what you do as a child can and will lead to cancer in the adult. So our job as pediatricians is to educate our children, teenagers, and our parents how to avoid these carcinogens. And we have to start at an early age, because prevention may be much better at a younger age, and it will be too late if we start later on. So how can we avoid these carcinogens? It's by behavior, by diet, by our lifestyle. The first example we're going to mention is smoking. Smoking increases the risk of cancer by at least 30%. And it's not only lung cancer, there's esophageal cancer, bladder cancer, and many other cancers we're going to discuss, for example, in the next slide. Let's focus a little bit on smoking, and the key is that children, if they're hooked on smoking before the age of 21, it is very difficult to stop smoking because of the nicotine addiction. And now we're all faced with vaping. Vaping has nicotine, and it is not safe. As parents and pediatricians, we have to emphasize to children to avoid vaping, because there is evidence that lung cancer can be associated with vaping, even if there's no cigarette smoking. And this slide shows you the 10 different types of cancer that are associated with smoking: liver, colon, rectum, lung, mouth and throat, esophagus, larynx, stomach, pancreas, bladder, cervix, and even leukemia, acute myeloid leukemia. And not only cancer, but there are many other health issues related to smoking, including immune system, bone density weakening, diabetes, and other eye diseases such as cataracts. So we have to always remember, when we see kids as pediatricians, to remind them about the risks of smoking. The second carcinogen that people don't think of is alcohol. Many people look at alcohol as an amusement drug. However, very few people realize that many cancers can be related to alcohol. Liver, esophagus, mouth, even breast cancer. And as doctors, we always advise patients not to start drinking. You may see cardiologists mention that 1 or 2 drinks a day may prevent coronary artery disease, and that's true. However, if you do not drink, the cancer societies in the US recommend not to start drinking because any drink, even one a day, can increase cancers, specifically breast cancer. And these are some health issues demonstrated in this slide that also tell you what alcohol can do, including gastritis, pancreatitis, nerve damage, mental issues, concentration, memory, dementia, even impotence in men. So please, as parents and doctors, remember to emphasize to our children, stay away from alcohol as much as you can. And the next type of cancer that is very avoidable, especially in Florida, is skin cancer. Since we have a tropical sun exposure with high UV light in Miami and South Florida, we have to remind parents and children to apply sunscreen every day. People usually say, oh, I don't go to the beach when I go to the beach, but pretty much living in Florida means going to the beach every day. So please apply sunscreen to the face and exposed areas every time you leave your home. Skin cancer includes basal cell, squamous cell, and melanoma, and it is preventable if applied in childhood. The skin cancer doesn't happen right away. We have to prevent that as children because it takes 10 to 20 or more years before that develops into cancer. So sunscreen in childhood prevents skin cancer in adults. So, and Florida residents must reapply the sunscreen every 2 hours, so one application is not enough. Let's move on to something very important, which is the relationship between obesity and cancer. So nutrition is very, very important. Obesity is an epidemic now in the United States. 1 out of 5 children falls under obesity or overweight. So it is indeed an epidemic. We're not exercising as much, we're not walking as much, we're sitting, texting, watching TV, watching Netflix. So people are gaining weight much more than we saw in the past. So diabetes, heart disease are commonly associated with overweight and obesity. But now we know that obesity is as bad as smoking as far as a risk for cancer. Look at this slide that shows you that colon cancer, breast cancer, endometrial cancer, liver, kidney cancer, there's at least 10 to 12 adult cancers that are directly related to obesity. So when we see children as pediatricians or as parents, we have to emphasize the importance of avoiding obesity. And that starts at home with children. How can we do that? Well, to start with, a Mediterranean or what we call a paleo diet with lots of green and leafy vegetables, lots of fruits and nuts is key. Certain fruits like strawberries, blueberries, and walnuts have antioxidants that are very important in prevention of cancer and overall health in general. Carbohydrates, sugars, juices, breads these carbohydrates are bad for general health, but also for the risk of obesity and ultimately cancer. For instance, when you look at sugars, there are natural sugars that are found in fruits and grains and nuts. Those are good carbohydrates, good sugars. The ones we have to avoid are juices, sodas, candies, and artificial sugary drinks. So there's the good sugar and the bad sugar. When we look at a plate, for example, we have to make sure that it has 2/3 vegetables and fruits and 1/3 protein, chicken, fish, turkey, and make sure you drink water with your meal, not juice, not soda. And a rule of thumb is when you look at a plate for lunch or dinner, make sure that it has many colors. It's a colorful dish. There's the green, the red, the orange, the purple, the blueberries. So try to avoid a monotonous color like white, rice, potato, pastas. Try to make your plate always colorful with 3 or 4 or more colors in your plate a day. So what foods are risk factor for cancer? Research now has shown that certain foods such as processed meat, bacon, hot dogs, and all these deli meats that have preservatives, those are definitely linked to certain cancers. Also, charred meats. If a steak is burnt, try not to eat the black part of that steak. Also, try to cut down on red meats. Fish and chicken, maybe turkey, are much better meat choices than red meat. So limit your red meats to once a week or even less. Try to make sure that your diet includes more whole grains, wheat, and other grains. So a next preventable cancer that's very important is a cancer related to a virus that's known as papillomavirus or HPV. HPV is a virus that's transmitted sexually, but it can affect both boys and girls. And now we have a vaccine, the HPV vaccine, that should be looked at as a cancer vaccine. It should be given to boys and girls between the age of 11 and 13. The more you wait, the later teenager years or adulthood, the vaccine doesn't work as much. So the HPV vaccine prevents not only cervical cancers, but also head and neck cancers in adult males and females. So please emphasize to children, pediatricians, teenagers, that the HPV vaccine is a cancer vaccine, and whether teenagers are or are not involved in sexual activity, it doesn't matter. Eventually, when they get married, they may be exposed to these viruses. So HPV vaccine is a cancer prevention vaccine, and working with the American Cancer Society, we have set up goals, as you see in this slide, that we want to prevent HPV cancer-related tumors in 80% of the people by this decade. So please emphasize and spread the word that HPV is a cancer prevention vaccine that may help us avoid cancers in the future. Next, let me talk about prevention and early detection. How can we modulate our cancer risk? Let's say somebody is born with a risk factor for cancer. That doesn't mean that that person is gonna get cancer. We have all heard of colon cancer genes, breast cancer genes, BRCA1, BRCA2. But remember that you can change your risk of cancer by the diet advice we just spoke about, but also by exercise. Moderate intensity exercise improves blood flow and strengthens your immune system. It reduces inflammation. Evidence now shows that inflammation is a risk factor for cancer, and we can change our genetic expression. Those genes that we may have inherited can be modified through a process of diet, exercise, even meditation. So exercise has been proven to decrease obesity, but also to decrease cancer. So should we get tested for cancer mutations? The answer is not clear. If there is a strong family history of cancer, specifically many cases of ovarian cancer, colon cancer, or other cancers within the same family, especially in people who are less than 45 years of age, then you could discuss with your doctor whether there is any value in testing for certain cancer genes. Typically, we test patients when they have cancer. For example, if an adult woman develops breast cancer, then certainly that lady can be tested for a panel of genes that can predispose, for example, to breast cancer. It's not just BRCA1 or BRCA2. There's probably 10 or more genes that may be related to breast cancer. So this testing should be done by a specialist, normally a cancer genetics doctor, where this panel of genetic testing is done. So we don't test children for cancer genes. We usually tell them by the time they're 18 or more, they have the choice to be tested for those cancer genes. There are exceptions, however, such as the P53 Li-Fraumeni gene that may cause certain cancers in children even before they're 1 year old. In those cases, we do test families because we have a capability to screen and detect cancers early. So what are some ways to screen for cancer? One is to do your annual checkups. Go to your doctor at least once a year. In women, we recommend the frequent breast self-exam. In women above a certain age, mammograms. But if there is a certain genetic tendency in a family, then there is more frequent screening. There are cases where we do annual MRIs of the body. We do annual testing for colon cancer risk. So based on a specific genetic predisposition, there will be some specific testing to be done. But in general, it's an annual checkup, maintaining a healthy weight, avoiding the risk factors we mentioned, smoking, alcohol, excessive sun exposure, avoiding obesity, making sure your diet is balanced, and if there's any concern, always go back to your doctor and ask for an evaluation. A lot of people ask us about vitamins. Are there any supplements that may help prevent cancer? And in general, in my practice, the only supplements we recommend are vitamin D, because vitamin D deficiency, especially that we're more indoors now, we're not in the outdoors, is associated with a higher risk of cancer. So I recommend vitamin D, I recommend omega-3 fish oil, and certain nutritional supplements such as turmeric, which is found in certain spices like curry and other natural products. So turmeric is a product we do recommend because it has been seen to have some cancer prevention. But otherwise, regular vitamins are not recommended. What I do recommend is the natural way of having vitamins: fruits, vegetables, and grains. So what we're going to do now, we're going to try to answer any questions you may have. So please type in your questions in the chat box, and we'll be happy to answer those questions. Do we have anything now? Feel free to contact us with either email or phone, and we'll be happy to respond to any questions. Here at Nicklaus Children's Hospital, we have one of the largest pediatric cancer programs in South Florida, and where we have clinical trials and we're available anytime to answer your questions or your concerns. Thank you very much, and we'll see you in a future physician chat soon.